So one last video here to think about, again, the protein misfolding situation that happens when we generate plaques that are the hallmark of Alzheimer's disease. And at the very end, I'll sort of connect what I mean by type 3 diabetes. So first, let's talk about what happens to generate these insoluble plaques that are a hallmark of things like Alzheimer's disease. Well, there is a protein in your brain called APP. It's a normal protein, but right now has an unknown function. So normal protein with unknown function. And what happens is there are some enzymes in your body called beta and gamma secretases that process this normal protein down into small alpha beta or A beta sort of fragments. So beta and gamma secretase enzymes are going to do their biochemistry on this APP protein, and they're going to generate these A beta soluble proteins. These are small. We should probably even call them peptides. So let me change that. We're going to call this a peptide because it's only 36 to 43 amino acids. So 36 to 43 amino acids. So not a very large protein. Remember, we said the minimum size of a peptide to have any sort of function is 40 amino acids. So this is really on the low end of this. But I want to highlight that this is a normal part of cellular turnover. There's nothing abnormal at this point. So this is still sort of a normal part of cellular turnover. Now, where things become problematic is if these soluble A beta peptides begin to aggregate. And we talked about in our protein folding funnel and sort of that idea of how we think about proteins folding, once you start forming interactions, that becomes stable, right? You become lower in energy, and sometimes you can become so low in energy that it's hard to sort of get out. So what you can have now is you have these A beta plaques. You have a whole bunch of these soluble peptides that start aggregating together, and they form these insoluble plaques. And again, the purpose of these plaques are to shut off brain function. And you might say that that sounds like it's really awful that we're shutting off brain function. But remember, there might be times that that would be an important thing for your body to do, right? Your body might want to shut off functions of your brain in response to what we're going to call acute trauma. So again, shutting off this brain function might be okay if you are responding to acute trauma. And the key here is acute trauma, short term, right? So you might sort of have physical trauma. We talked about concussions and traumatic brain injuries. So TBIs and concussions. To allow the brain to heal, you might shut off brain function by putting these plaques in there. You might have a short-term toxin exposure. Right? Might be an infection, might be exposure to metals. Lots of things can cause this acute trauma that will allow your body to produce these plaques. They sort of shut off and wall off that section of the brain, allow you to deal with that acute trauma, and then the plan is get rid of them. Okay? So again, when you're responding to this acute trauma, okay, I'm going to highlight over here, when the acute trauma is done, you need to get rid of those plaques. So here's some of the protective measures that we know we can use to get rid of those plaques. So we can eliminate plaques using things like the glymphatic system. That's essentially the lymph system in your brain. We can use ApoE, right? We talked about ApoE in our learning unit on nucleic acids and nucleotides, right? Because we learned about that as an important SNP. And if you don't have functioning ApoE, if you have the ApoE4 isoform, you are less able to do this clearing of plaques because the ApoE sort of lipoprotein helps to eliminate sort of these plaques. And tied in with this is the importance of sleep. Because your glymphatic system is going to operate when you are asleep, and the ApoEs are going to be part of getting in there in that glymphatic system and helping you to clear this detritus out. Okay, so here again is the key. Trauma is supposed to be acute. It's supposed to be short-term. Physical trauma, exposure to toxins like a short-term infection. Here's where this piece on type 3 diabetes sort of comes in, because you're like, Dr. Perenni, you've only told me about type 1 diabetes where you can't produce insulin, or type 2 diabetes where you don't listen to the insulin that your pancreas is overproducing. So here is a third sort of trauma that we can have. I want you to be able to think about that, and let's actually say that this is not an acute trauma, this is a chronic trauma and stress, okay? Inflammation is again meant to be short-term in your body, but if you have chronic inflammation, that's going to be a problem, okay? Here's how this ties into sort of the diabetes thing, okay? Inflammation will happen if you have elevated levels of glucose, okay? Elevated levels of glucose should normally, I'm going to shift this over so I have some room here. Elevated levels of glucose should produce elevated levels of insulin. But if you have become insulin resistant, right, then you are not going to be able to eliminate that glucose, right? So really, insulin resistance, which is what we know to be type 2 diabetes, really causes chronic inflammation. That chronic inflammation is essentially something that can get your brain to think that it's responding to inflammation that is unfortunately in a chronic sort of state. So you still are going to produce these A beta plaques. It's going to shut off brain function. But because this inflammation is chronic, your clear out system never gets a chance to operate. You're constantly in that traumatic state. And so that's why Alzheimer's disease, because of its connection to blood sugar dysregulation, is often referred to as type 3 diabetes, sort of the initiation of Alzheimer's disease by that chronic inflammatory state.